Hi everyone, it's Samira just checking in to see how everyone is doing and to go over some of the grading points in this course, and also to make sure that everyone at this point has reviewed the syllabus and understands that you're responsible for the terms of the syllabus. Some of you have reached out with certain questions and have gotten back to you via email. You can do that at any time, of course, but I do want to go over some of the terms of the syllabus and the policy that the university enforces, okay? And so, of course, with it being an online course and the participation being a significant part of your grade, 30%, you want to make sure that you're staying on top of that. And I know a few people have gotten have reached out to me if they've had a personal emergency and it was going to cause an assignment to be late, and I understand that, but unless you make arrangements with me about extenuating circumstances as to why something would in fact be late, you are going to lose points if the assignment is accepted at all. Making provision for that beforehand really is my policy, and then Widener puts it at the discretion of the professor, but I want you guys just to be mindful of the deadlines, the time and day, right? So for discussion, Thursday by 11:59 is the cutoff, and then your responses back to your peers is Sunday by 11:59. You want to just make sure that you are being mindful of the deadlines when you're submitting quizzes and the vignette papers. Be mindful that you don't put yourself to the very last minute to do that. You don't want to lose any work. So I would also advise you to keep your work in a Word doc, your responses, or in an email before you submit them, so that you have a backup in case something doesn't go through. You guys are doing great with the discussion post. Overall, great quality and thoughtful responses. I really appreciate that. What I do want to add about the discussion post is that you want to make sure, and this goes for your paper too, you want to make sure that you're answering the questions that you're being asked. And so a few of you, I have emailed some feedback for you to consider. It's really important for you to make sure that you, and I know sometimes this is taught maybe in other classes, I remember these days, but you want to make sure that you're focusing in on what you're being asked and that you're answering that question thoroughly. And if it asks you, the prompt asks if you agree with it or if you don't, state that, like, I agree because, I disagree because. Many of you are doing that, but you want to make sure that you're embodying the question that's being asked and that you're answering it thoroughly. That does count towards the points, and it will also help you to be really succinct in the writing of your papers in this class and going forward. Again, for submission of assignment, just going back to the Widener policies per the syllabus, if something's going to be late, you need to have pre-approval about that. Life certainly happens, but this is a summer course. You want to make sure that you're not falling behind, because there is a cutoff for when I have to submit final grades. For the revision policy, if you receive a B- or lower, you may be able to revise it. We would have to schedule a conversation about that, but I'm happy to talk with anyone who needs support in their writing and they realize that. I definitely can be a resource for you. And if there are papers that receive a B- or lower, I will get in touch with people. Traditionally, people have done really well with these writing vignettes, so I don't expect that there would be revisions needed, but if it comes up, we'll deal with it, no problem. And overall, when it talks about incomplete as a possible grade for the course, that's if you have just like just a significant emergency and you're unable to complete the course. We could talk about that. However, there would have to be substantial justification for that. And I want to also talk to you about communication. If there's any, challenge that you're having with an assignment or anything preventing you from really performing well in the class, please do reach out to me. We can talk on the phone. We can do video conference. I'm here to support you, but do let me know. I have to report to the program director if there are students who aren't doing well and also aren't communicating that if there's like any problems. So if I've emailed you to check in, please let me know if there are issues so we can work it out. I want everyone to do well in this course. So your favorite part, the assignments, right? We went over class participation with the discussion post. The discussions are easy grades. It's 30% of your grade, all of the discussions for the course. And so it's really important to critically think about the questions that are being asked. And even in your responses, there are a few of you who do really well in being able to express if you don't agree with something, and that's really needed. It's important to be able to assess why you agree with it and why you don't, and it's okay if you agree with maybe part of something but not the whole thing. Like last week, a couple of you regarding the case study talked about why maybe one of the suggested diagnoses could be accurate, but why some of them you didn't feel were supported because of the client's trauma history. And so that was really excellent in being able to justify your clinical impression. The clinical impression in last week's post was concerning whether or not you agreed with the suggested diagnosis, okay? And so that's class participation. So far with grading the quizzes, everyone has done pretty well. I'm still working through those, and those grades will be up later this evening. Both quizzes for week 2 and for week 3 are each worth 10% of your grade. And then when we're talking about the clinical vignette paper, part 1, I'm going to go over that, but I do want to clarify that both Vignette 1 and Vignette 2 are separate from the condition presentation. If you have any questions about that, please reach out to me, but I will clarify it more in this video, okay? So whenever you're talking about your papers, the Vignette 1 and 2, you must use APA style, and you can review the writing skills expected in your syllabus, and also APA style. If you, for any reason, have questions with APA, also feel free to reach out. You can also check Widener's website. They have some resources there too that are helpful. And what I also want to mention is that each assignment has a rubric, and the rubric explains what I'm looking for. Whatever the points are assigned, the areas, that's what I'm looking for. So for the discussion rubric, there are points there that are listed, and so please check that out if you haven't already done so. I know many of you have. And so we can talk about Vignette 1, okay? And so I posted the breakdown of this assignment in the announcement a week or so ago, and I want you to really check that out because there are some sample biopsychosocials in there that I posted. Again, you can't use that format. Your paper must be in APA for one, and for two, you have to make sure that you're covering the guideline, like the outline of the assignment. You have to answer all those questions. And again, use the rubric to help write your paper. I use the rubric to grade the papers, okay? So for Vignette 1, let's talk it through, okay? So introduction, So it's worth 20 points and it's due at the end of week 4, Sunday by midnight, okay? So first part, introduction, explain your role with the client and in what context you work with the person. Really easy. Think about this paper in terms of you are the clinician and you're presenting this case to a colleague, or you're preparing like their assessment for their chart, okay? Think about it in those terms. So what's your role? Are you their private therapist? Are you their therapist in a behavioral center? Are you in an addictions treatment facility? Like, what's your role with the client? How do you interact with them? Are you their case manager? What's the role that you have with them? And what's the context, right? So explain that and make it clear. This can be like one paragraph. Identify the data sources for the report and the source of the referral. Data sources are simply where you gathered your information, and the source of the referral, how did the client come to work with you? How did they come to your agency? How were they referred to your private practice? How did they become part of your caseload? Explain that in terms of like the facts. So I've had previous clients transferred to a facility that I worked at. I've had clients reach out to me because they wanted to do some private trauma therapy work, but they wanted to work with a private therapist. I've had clients who were mandated. I've had clients who were voluntary. So explain how the client came to work with you. The next point, list the identifying information. And so for this, if you look in your syllabus, if you look in this section, you have questions here. You want to answer all of the identifying information. So with their name, use an alias, don't use real names, of course, but age, gender, race, sexual orientation, nationality, you can read all of this, but you want to make sure that you're providing this information, because when I read this paragraph, I want a snapshot into who you're working with. I want to know education level, socioeconomic status, if they have children, if they're married, kind of what their demographic information is, okay? And if you don't have information for this section, you should have most of it, but if there's a piece of it that you don't have, please list that. And so for education, you might put something like, to the best of my knowledge, my client has finished 10th grade. He at this time has not obtained a GED, though he may consider that in the future. No college experience at this time would be how you would answer that question to identify that piece of information. So presenting problem. This provides a concise description of the presenting problem. And this is important. The presenting problem is what's the problem that the client presents for services. So why are they coming to your place of employment for services? Why? Next is the chief complaint of the client. In the client's own words, it could be a sentence, use quotation marks. Why does the client feel that they're there? The client may not feel like they're there for the actual reasons why they're there. Does that make sense? Leave a comment below if you have any questions about that. So for example, the presenting problem could be a woman is presenting for drug treatment. It's mandated in a custody agreement, if she wants to continue custody of her children, she has to complete an IOP or outpatient drug treatment course of treatment, right? But she may come there and once you do your intake with her, she could say something like, I'm here because I have been clean for 90 days and now the court says I have to do drug treatment and I don't think it's necessary, right? So she's there just to complete the requirement to get her kid back, right? Or to keep custody and have the child welfare case closed, right? You want to make sure that you are really clear about what the presenting problem is and what the chief complaint of the patient is. And each of those could be less than a paragraph. Okay, describe the history and context of the problem situation. So why are they really in treatment? Like, what's the real problem, right? Because the real problem with the example I just gave you could be this woman has 4 children. They're all at some point have been in child services. She's had ongoing drug and alcohol issues. She has unstable work history. Her stability is in question of whether or not she can parent these children, and Department of Human Services may be involved to kind of evaluate if she can parent these kids long term and what the next steps could be, right? That could actually be like some of the background. So what's the context of the problem situation of your client? And then you want to go into the brief history of the psychosocial factor and family history. This can be anywhere from 2 to 3 pages, I would say. You don't have to make up like a soap opera, right? You don't have to do like a 10-page psychosocial background for this section, but you do want to make sure that you're giving a context to the problem situation. You want to talk about if it's a recent or long-standing issue. This is all found in your syllabus under problem description. You want to talk about the course of the problem development. So if you're talking about a client who, if you had a client who, let's say you're talking about has a long-standing depression issue, and that's part of the presenting problem, you would want to talk about the trajectory of the illness. How has it impacted this person's life? So in their 20s, they managed it. They were functional. They had some support. They may or may not have taken medication. They were single perhaps in their 30s. This person got married, had a child, maybe worked part-time, but maybe there was a triggering event, and then symptoms began to increase and they became less and less functional, and that would lead you up to present day. You want to break down the course of the presenting problem, whatever it is, right? Okay. And then you want to develop a list of current diagnoses and include current treatment. So what are they currently diagnosed with? It's not necessary to say that you diagnose them, but what are their current diagnoses? So you've been referred this patient and maybe they present with major depressive disorder and PTSD, right? For example, so you would state that and you would list their current medication regimen. You can Google whatever the diagnosis is and look up suggested medications, psychotropic medication, to find that information if you don't have an actual patient that you're talking about, right? That will help you with that section. And then again, state whether or not you agree or disagree with the person's current diagnosis. So again, separate paragraph, state if you agree or disagree and why. So this is where you're offering your clinical impression. So say it's someone like Danny, where they have these 4 or 5 diagnoses, and you feel like there's an underlying issue of significant complex trauma or long-standing emotional abandonment. If it's like for the case last week, this oppositional defiant disorder, if that's what your patient has been diagnosed with and you don't agree, state the facts and then state why you don't agree, and make sure it's in sentence form, and do your best to make it more than just an opinion, right? So I had a case like this early in my career. The lady was diagnosed with schizophrenia. I never believed she had schizophrenia. I believed that she had complex PTSD. I believe that it was very severe. I also believe that she had like a mood disorder, right? That she needed a mood stabilizer. But I also understood that because of her limitations in life, she never had treatment, she never had proper support, she had a 20-year drug history because she self-medicated, she presented with the classic symptoms of schizophrenia. And so I had to navigate this construct that she was currently in with the reality that she was in no real safe place mentally, emotionally, financially to do the trauma work necessary to relieve some of her symptoms, right? So if this were you and the person had a diagnosis that you didn't believe in, you want to just support what your clinical impressions are around that, okay? And then you want to assess the signs and symptoms of the DSM-5 diagnosis, right? And you want to kind of explain if the signs and symptoms are related to substance use disorder, trauma, long-standing like disorders, right? So if they have like this depressive history, you want to go into that as it relates to how it supports or does not support your impression of whether or not you agree with the current diagnosis or not. Okay? And then once you, hang on, I got a little ahead of myself here. Again, use your rubric to write the paper because that's what I'm using to grade the paper. And so I explain the bullet points in the syllabus of what the paper must contain, but the rubric tells you how to set up your sections. So if you follow the rubric, you'll be just fine, right? Under presenting problem, there are a few more biopsychosocial questions that you'll want to use in your paper. It's always good to use headings in your paper that is part of APA format. Two of the things that I didn't mention under a brief history of presenting problem, you also list the patient's supports and also list your view of the problem and expectations. That's listed again in the rubric for Vignette 1, and then it goes into the diagnosis and medication, okay? And so when you're giving your rationale for the assessment of the DSM-5 symptoms, there are sections here for you to follow, A through E, again, in the syllabus. You want to make sure that you're defining the challenging behaviors and behavioral manifestations. You want to make sure that you are defining that. State what behaviors may relate to the signs and symptoms. Behaviors including, is there substance use disorder? Has there been a history of substance use disorder? Is there childhood trauma that you're aware of? Are there disorders that for a long time went untreated? That's helpful information to support this section of the paper. You also can put in things like just like really poor nutrition, can impact someone's mood and like their ability to handle stress. Simple things like that can be important information. Eating disorders can be another one. Those types of things can really impact symptoms, and they can present as a separate mental diagnosis when it could be biological or environmental. You want to assess the person and determine 2 or 3 differential diagnoses. So if the person is diagnosed with major depressive disorder, but you feel like they have PTSD or maybe an attachment disorder, you're going to provide here 2 or 3 differential diagnoses that support the behavioral manifestations. So for this section, I should be able to match the symptoms that you've listed in the previous section to the diagnosis that you're suggesting in this section, okay? So pull out your DSM-5, use that information for this section. If you have questions, let me know. You guys should be working on this draft now, so that if you have questions and need feedback, I can help you with it before it's due. Also, you want to give your rationale for each differential diagnosis, okay? It's fine if you just have 2 diagnoses for this section, that's fine, but you have to work all the steps for each diagnosis. Be sure for you to do that to get all of the points there and really to help you conceptualize it for yourself. Also, make a list of any diagnoses that have been ruled out. So if it were someone that was diagnosed with PTSD, maybe bipolar disorder had been ruled out, and you would mention that, okay? So that sums up, and then you'll want to just do like a brief conclusion paragraph. That sums up Vignette 1. It needs to be like the actual paper version is a max of 10 pages. Sorry, so the Vignette 1 is a max of 12 pages, and the title page and reference page are not included. So you will be asked to edit it if it's more than 12 pages before I'll grade it. And this paper should at least be no less than 3 or 4 pages, right? Like it shouldn't be any less than that. So I know some of you may write really succinctly, and I understand that. Totally fine. So no less than 3 or 4, no more than 12 pages. If you have any questions, please let me know. I will do a separate video for the second part of this vignette paper to go over that separately. But I also wanted to just touch briefly on the conditions presentation. So the conditions presentation is due in week 6, and all of you have partners except for one person, and I have talks with her. For this, in the syllabus again, condition part A is listed. So you do the introduction of the condition, you provide a video you can get from YouTube that describes the condition. It can be anything that you choose, and then you have to have a slide for your references. That's part A. And the introduction can be a couple of slides. You know, when you talk about an overview of the condition, depending on your condition, how does it impact somebody? How does someone live with it? What do we know about it? What improvements have been made? Have there been setbacks in research? Those are all adequate questions to consider when you are overviewing like a condition. That's part A. Part B of the condition presentation. This is a separate assignment from the paper, okay? Student B is to look up 3 to 5 articles and describe them, and use different slides, of course, for each resource. I don't need a 20-page summary. I'm not looking for 20 slides here, but if you're giving me the cliff notes to this article, what do I need to know? What's vital to me understanding this condition? How does it impact people? Is it political? Everything's political. Is there something around it that I need to know in terms of treatment advances or setbacks? Those are the types of things you'd want to put in your summary. And then again, you want a slide that is your reference slide. And so that's section B of a condition assignment, okay? And then we will talk closer as we get to the actual presentation, and we will go over that separately as well. The last thing I will mention is do your very best to stay up to date on the reading assignments. I know it's a lot of reading. I get that, but believe it or not, there are classes that have more, and the information really helps you to guide your decisions when making clinical assessment, and it also helps you to have a holistic view, as we've been talking about, what factors are considered in mental health and in mental illness. Again, psychological, social, biological, environmental aspects. These readings help you to really hone those skills. And this week especially, this week 3, talking about trauma and stress disorder, really important. We have so much of this in our society currently. It's important that clinicians are really up to date on the latest research. And so, again, if I can help you or support you or clarify any questions, please reach out to me. I'm happy to assist you. We can get on a phone call, like I said, or a video conference and go over your specific questions. But hopefully this helped you understand how you're setting up Vignette 1. Also refer to the announcement that I made over a week ago that breaks down these aspects of the paper as well. And if you have questions about your paper, the person that you're choosing, please reach out to me so that we can talk it through and make sure you're on the right track, because Vignette 2 is based off of this Vignette 1. So you want Vignette 1 to be strong and hitting all of the points accurately so that you can expand upon it for Vignette 2. Okay? Any questions, let me know. Thanks for listening. Have a great day, guys. Bye.